you live in the United States, chances are you've heard of the Tuskegee syphilis study, wherein 600 Black participants were being treated for bad blood. 399 men had latent syphilis, while 201 men were in the control group. The researchers wanted to see what would happen when syphilis was left untreated. These men were not only told that they were not being treated, but they were not even told of their diagnosis. By the end of the study, 28 men had died directly from syphilis, and 100 had died from complications due to syphilis. And 40 of the participants' wives had been infected with syphilis, and 19 of the children born with congenital syphilis. Although this is probably the most well-known example of unethical medical experimentations on the Black community, this is not an isolated incident. There are many reasons why researchers chose Black patients for experimentation, primarily because doctors didn't see Black people as, well, people. Black participants were regularly compared to apes, both physically and cognitively. But this was not the only way researchers sought to dehumanize the Black community. Doctors and scientists believed that Black people would have a higher animalistic sex drive, as characterized by enlarged breasts, genitals, and buttocks. One common practice was female circumcision. Physicians believed that Black women had excess labia, so they would do what they considered to be a favor of cutting it off. But another common belief in the world of medicine at the time was that Black patients had a much higher tolerance than white patients. So naturally, they assumed their patients were fine, in spite of the screams of pain. This belief actually resulted in high rates of amputation among Black patients. One physician stated,
"The decision to amputate should be different according to the person's race and class. Amputation should be very differently estimated in the classes of society. Although such an extreme remedy is a horrid deformity that should be the last resort for a rich man, amputating the limb of a slave was a matter of comparatively little importance. Students should hesitate much less to remove a limb if he be slave than if he be a free man, and especially a white man."
Members of the Black community were also often used as demonstrations in medical school classes, leaving future physicians with the harmful mindset that Black patients are demonstrations and experiments. Sam was a slave in Alabama and was experiencing lower jaw pain. The doctor determined that Sam was suffering from osteosarcoma. Although Sam did not want to receive the surgery, his owner consented for him. The surgeon, Dr. J. Marion Sims, elected to operate on Sam in front of an audience of spectators and medical students. Sam was strapped to a chair, and for 40 minutes, part of his jawbone was removed without anesthesia. Sims also experimented on Black babies. He would open the baby skulls in an attempt to prove his theory that Black baby skulls grew faster than white baby skulls and thus prevented their brains from developing or growing. When the majority of the babies died, Sims attributed their deaths to their lack of intelligence. His most famous victim was a young Black woman named Anarcha. Sims performed at least 30 experimental operations on Anarcha without the use of anesthesia, despite the fact that anesthesia would become available to physicians during this time. But who is even more famous than Sims? Well, a lot of people. But we're going to be talking about P.T. Barnum and his slave, Joyce Heth, a Black woman around 80 years old at the time of her death. Barnum claimed that Heth was 161 years old and George Washington's childhood nurse. Heth was not only Barnum's slave, but she was also blind and mostly paralyzed. Barr even removed Heth's teeth without the use of anesthesia to make her appear older. And due to her condition, many believed Barnum's absurd claims. But those who used their critical thinking skills did not believe Barnum. Thus, Barnum promised that when Heth passed away, there would be a public autopsy, and 1,500 people paid to see this public dissection of Joyce Heth. The biases and misperceptions that led to such an inhumane act still negatively affect Black patients to this day. There's just so much to talk about that cannot fit into this video for class. I would highly recommend reading or listening to the audiobook of Medical Apartheid by Harriet A. Washington. I encourage you to learn more about the exploitation and abuse of the Black community in the medical world and experimentations.